So a year ago, we were supposed to be seeing the light at the end of the pandemic tunnel. Well, with the COVID vaccine being administered for the first time 365 days ago. That light is still there, but it's still kind of keeping its distance because deep into this pandemic tunnel, we're still seeing new developments, which lead to a lot of new questions. Omicron variant, for example. Does the new strain have the potential to create as many issues as Delta did here in Idaho? What if, for example, Omicron is more contagious, but not necessarily as serious, doesn't yield the serious health issues like we saw with Delta? Is that a good thing? We asked those questions and more earlier to Idaho health experts. In fact, Joe Paris jumped in on the COVID media briefing this afternoon. It's a weekly briefing that they've been doing. I don't know what number it is. They've been doing it since, well, pretty much this whole thing started. So I don't know where we are when it comes to how many we've seen, but there've been a lot. And so this latest one kind of had some, well, hopefully new information, especially about the new variant, right?
Yeah, and that's something that I think Idahoans and a lot of people have been talking about for weeks, Brian. They want to know, what is the deal with this Omicron variant and what do researchers know? Well, it is still very new to researchers, but we do know there are some major big takeaways that health leaders are able to glean from early available data worldwide. Now, a big one when it comes to the Omicron variant, reportedly, Omicron has risks associated with it, and experts are still looking into how those compare, though, with Delta variant cases. Now, protection against Omicron, it's crucial, according to experts, especially heading into the holiday season and the new year. Now, there were major hopes that Omicron would be contagious, but not very dangerous, but maybe just all benign together at the end of things. But it looks like, according to early data, that is not going to be the case with Omicron. And with scientists trying to keep up with COVID strains, experts advise that you get out there and you get a vaccine as soon as possible if you haven't. And they also advise that you get out there and get your booster shot as well as soon as you're available. Now, state epidemiologist Dr. Christine Hahn says the immunity question in terms of how effective vaccines are against the different strains, well, it all continues to evolve with each strain, including with the Omicron variant. Take vaccine and natural immunity questions between Delta and Omicron variants, for example.
Worrisome signals that neither vaccination on its own nor natural immunity, as it were, people who've been infected is probably going to be as helpful as it was for people who got Delta or an earlier variant and now really had to face potential infection with Delta.
So through the pandemic, there has been a theory and a hope out there that eventually the primary strain of COVID will be contagious, yes, but it will not carry the health impact with it, meaning that through so many mutations, the virus would become very, very mild to the point that COVID is really just like the common cold. Some had really hoped that Omicron would be that variant, but it appears, according to research, that is not the case. So hypothetically, though, Dr. Hahn says a mutation to the point of COVID being like the cold, well, that would be a very welcome development.
If we had a very transmissible virus that gave us some immunizing effect that protected us against nastier strains, but didn't make us very sick, we would feel that the pandemic was essentially under control or over. This had now become something like a cold virus or something that caused only very mild illness. But I think what's important to note, as you know, is that these new variants coming along might be more severe, they might be a little milder, but there's nothing driving them towards becoming milder and milder.
And we've seen your questions and concerns about overloading your system, so to speak, with vaccines and boosters, as well as the possibility of getting a case of COVID in the community. Now, more recently, we've seen a question come into our newsroom, and it goes as follows. If someone is fully vaccinated, but they get COVID, and they get a breakthrough case, as it's called, should they still get vaccinated, or is the natural immune response with the breakthrough case enough? Now, Dr. Hahn had this insight on the question.
I would say with that person, they are probably best just to talk with their physician about whether they still need a vaccine. You know, having been fully vaccinated plus getting the disease, that's a lot of exposure. And I would say that they would want to talk to their doctor about that.
So, Brian, I know there's still a lot of questions about the Omicron variant, as well as, when could the virus end up, being so mutated that it is almost benign? We don't know the answers to this. And scientists have been following COVID since the very beginning. And unfortunately, as soon as we know the answer, it changes the question. So it's kind of wait and watch with some of those higher level questions.
We heard this, almost 2 years ago now when it first became known, COVID-19, the SARS-CoV-2. That, viruses, they have a pattern, they kind of follow it. COVID's kind of been a little tricky with that. It hasn't really kind of fit the bill when it goes to here's how it's supposed to happen. It has, but it also hasn't.
I'll answer that quickly. Talking to medical experts from across Idaho and in the United States, COVID is rewriting the textbook on viruses and pandemics and kind of epidemiology.
Yeah, so it just kind of, as you said, we don't know what we don't know, and because there's a lot out there we still don't know. And it's going to come at us every day or every week since, or till we know, I guess. Thanks, Joe.